Namaste, Dr. Niharika.
Namaste, Dr. Simha.
Welcome to Bangalore Bowel Care, a comprehensive gut wellness and butt wellness clinic in Bangalore. We're all living longer. Longevity is something we all aim for. Amongst them, I think the wellness is very, very vital. It's not about just living longer, but about living well. And what we have realized is, in the recent years, the gut forms a very vital aspect and an integral component of your overall health. Here at Bangalore Bowel Care, we see a lot of problems related to the gut and the butt, which is the pelvis, from bloating to pain, constipation, diarrhea, bleeding, fissures, hemorrhoids, etc. In fact, 95% of the problems we see do not need an operation. It needs changes in the lifestyle. And I think one of the other big moves of late is integrative medicine. So tell me, Dr. Niharika, how is integrative medicine playing a vital role in the management of disorders of the gut and the butt, especially now that summer has kicked in? The relevance of seasons to the integrative therapy in terms of managing the gut and the butt problems.
Let us start with the definition of Ayurveda. Ayurveda is a science which deals with the holistic approach of the body, mind, and spiritual aspect with the natural treatment and the lifestyle modification. So, in Ayurveda, first we deal with the doshas. There are 3 doshas. One is Vata, Pitta, and Kapha. Each and every body is different. So, in the summer, usually what will happen? Kapha depletion will happen. There is no moisture. And the predominance of Vata and Pitta we can see. So, in the summer, especially what we call in Ayurveda, it is Grishma in Sanskrit, we need to moisture ourselves in the form of medicine with the natural sources in the form of Panchakarma. In Panchakarma, first let me finish off the Panchakarma while doing Snehapana or oil application, and along with the few medicine aspect, that is Basti, that we introduce oil based one in the form of enema. And in the another aspect, yes, we need to improvise in the diet. Diet in the sense, eat light food which is easy for the digestion, better absorption, and which have the cooling agent. And more of hydration, eat lots of fruits, it's lot of vegetables. Instead of opting high protein or hard for the digestion or any high fatty food, we need to include more of carb based, easy for the digestion, and vitamins, mineral components. And on the another aspects, lifestyle modification, we need to wear light clothes which is light shaded in color and which is like more of the cotton based one.
Lovely. So essentially, I think it's about blending nature with the nurture and also use the mindset.
Yes.
So like you said, I think utilizing the opportunity of the seasoning, 1, to hydrate yourself, 2, to wash out the toxins, and be lighter on the system.
Yes.
Correct? How lovely, how lovely. No, thank you, Dr. Niharika. I think it's very vital because half the problems we see, especially in the summer months, are related to bloating, constipation, not able to go to the toilet, feeling tired. And a lot of these can be rectified just by this integrative medical approaches. So I'm so grateful that we here at Bangalore Bowel Care have integrated Ayurveda into the mainstream of managing non-surgical problems. Thank you, thank you. And we also do a lot of rehabilitative programs, and you have been helping out greatly with it. What is your thought on those things, Dr. Niharika?
Yes, in rehab, mainly we include diet and yoga. Why it is necessary? Instead of giving a medicine, we need to treat from the basics so that it will help for the patient. Instead of giving steroids or any medication, day-to-day lifestyle changes will make more difference. So we include few dietary changes and along with the yoga. What will do with the yoga means mainly we focus on the pelvic yogas.
Right.
Out. Along with the concentrate on gut and brain axis, we teach pranayama.
Lovely.
That will instantly stimulate gut and brain axis.
Very nice.
And most of the patients who are coming to the Bangalore Bowel Care, we can see there is stress levels, IT problems, work schedules, everything. They need to manage with their stress levels. So that's why we are teaching pranayama to cool them and make sure at least one physical activity should be there on the regular basis.
Lovely. So I think we are talking about integrating the gyri or the brain, the bowel or the gut, as well as the gate or the back passage. So I think integrating the top, the middle and the bottom and working towards a better overall health is what we are dealing with here.
Yes.
I think this, like you rightly said, when we do our therapies, what we call as abdominopelvic anal rehabilitative therapy, in addition to rehabilitating the mind, we optimize all these three things so as to relieve the abdominal symptoms of bloating, pain, discomfort, fullness, etc. And also optimize the pelvic floor with suffering with pain and discomfort and heaviness, and also preventing things like fissures and hemorrhoids. So I think this is an integrative approach which is very well done. Of course, integrating Ayurveda into the mainstream, integrating yoga into the mainstream, and dietetics have been playing a huge role. So I'm so grateful that we've been able to manage here at Bangalore Bowel Care on this perspective of rehabilitation, Dr. Niharika. Do you have anything to say for the people
one
out
more
there?
thing I need to add. Forgot to add about the dietary one. Since people don't know what is pre and probiotics, which are necessary for the gut health. Every day-to-day lifestyle, few people, they Google and they forgot to take pre and probiotics in a right proportion. And high fiber diet, high protein diet, which are very much necessary for the better absorption in your gut. So once
So diet forms a very vital aspect with integration of good bacteria.
Yes.
Probiotics, prebiotics, enough fiber, water. So it's going back to the basics really,
Yes.
isn't it? Wow. Thank you, Dr. Niharika.
Thank you,
Absolute
Dr.
joy to
Simha.
have you had. Thank you.
Thank you.